going to lay down now, do a little bit more breathing. And what I would suggest that you do is take your bolster toward the front of the mat for your knees to rest on, and then you can let your head go onto your blanket. You just lay down on your back. And if you need extra padding under your pelvis, you're welcome to use an extra blanket there. Just let yourself kind of settle into this new relationship to gravity. And we're going to place the hands on the lower part of the abdomen. So your thumbs are more toward the navel, and your fingertips are pointing more down towards the pubic bone. And this is a very simple exercise to just breathe consciously into the abdomen, specifically the lower part of the abdomen. So before you do anything, just resting the hands there, is there any movement from the breath? When you inhale, you may feel an expansion in the belly. The hands, or the belly moves into the hands. And when you exhale, you may feel a sort of relaxation or falling of the belly back down towards the ground. Just feeling those two movements and mentally linking them up with the breath. Continuing to encourage the breath to move as low down into the abdomen as it will move. So you'll probably feel some movement where the thumbs are, but see if you can feel any movement all the way down to where your fingertips are. The more we can drop the breath lower inside the torso, generally the more relaxed this, or relaxing this exercise is for us. We often hold tension in the belly for many different reasons. It's a protection mechanism for the lower back. Sometimes we're sucking it in because we look thinner. All kinds of reasons why we hold tension in that abdomen area. So part of this exercise is to see if you can really relax the abdominal wall so that breath can move there. And we know that technically there's no lungs in that part of the body. The lungs are much higher up. But as we start to relax the abdominal wall and we take a breath in, the lungs expand, the diaphragm pushes down on the abdominal organs. And since we've got a bony spine in the back of the lower body, the only direction that the abdominal organs can go is forward. So what you're feeling is actually a movement of the organs, which is very good for them because it helps to massage. Every time you breathe and the diaphragm is moving down on the inhalation and up on the exhalation, you're massaging not only the heart, but all of the abdominal organs as well. When there is a lot of pain in the body, this can be a helpful exercise to encourage less muscular gripping and a little more relaxation. Not only does it give your body and your mind something else to focus on, which can be a really helpful mental exercise, But having the breath come into this lower part of the belly will start to encourage a relaxation response in your body. Your nervous system will actually respond to this belly breath. You know, the breath and how it connects to how we feel is kind of a chicken and egg situation. You can, if you're feeling stressed or you're in a lot of pain, if you try to take long breaths, especially making sure you're exhaling, pain reaction in the body tends to make us want to inhale and hold it. So making sure the exhale is really slow and even can help you to relax around the painful part and release stress. If you were to, now don't do this, but if you were to be breathing in a sort of, not exactly hyperventilation, but if you're upset, the breath will get very shallow and high up in the chest and short. And you can actually, if you did that, you can make yourself feel really stressed out even if you weren't stressed out. So they affect breath and mood are very much linked together. So just taking a few more moments here with hands on lower abdomen. Checking in with how it feels to the body to do this practice. And then let the hands relax to the floor. And from that position, we're going to transition into a little bit of reclining movement. So to start with, from the position that you are in, let your knees bend just one at a time until your feet come up onto the bolster. And then you're just going to push the bolster toward the end of your mat. So get it out of your way. Just kind of straighten out the legs. And it may feel good to you to have the legs straight. If that doesn't feel good to you, you could always rebend them. But just take a moment to stretch the legs. Take a breath there. Low back is feeling iffy. Rebend the knees.